So, this is the final presentation. So if you hate it, rest assured, things won't get any worse than this. This is the first findings from a project which is in its final stages. And the project is called Transmission and Trust. I'm calling the presentation today Trust and Transmission because I'm going to focus on trust. The project is a quantitative social science survey project looking at responses to COVID within British, Jewish and British Muslim communities. Next slide, please. Typical COVID slide fashion. So, the story so far, what I mean by that is, I want to think about the academic and media accounts of COVID within British, Jewish and British Muslim communities, particularly the popular media accounts. Now, it would be very easy to stand here and say either there was lots of celebratory material and this project looks to celebrate the work done in these communities, or I could stand here and say there was lots of negative accounts of these communities and I'm here to push back or defend them. I'm not here to do either of those things, and actually the world's a messy place, and actually this data set is quite messy as well. So some of the work here supports some of the positive accounts and some of the work here supports some of the negative accounts. Next slide, please. So this is a very quick whistle-stop tour of the survey. So we surveyed just under 2,000 people, and 1,000 of them were from a UK-wide group. So they were representative of the nation at large, the general population. We also had 400 Jewish respondents and 400 Muslim respondents. And whilst that number is actually quite low for the type of survey work I typically do, both groups are nationally representative. So they come from a group of Jewish and Muslim respondents who represent each of their respective populations, and they were chosen at random. Next slide, please. Without wanting to go into the questionnaire too much, these were the themes that we covered in the survey. So testing, symptoms, self-isolating, trust, vaccination, and COVID rules and restrictions. Next slide, please. Right, so key finding one. This some data looking at self-isolation. So we asked the respondents, have you self-isolated during the pandemic? Instantly, what you can see is that Jewish and Muslim respondents were more likely to have self-isolated than the general population. So that really pushes back on some of the negative accounts we had in some local and regional media, which were accusing both groups of not sticking to the rules, not listening to public health advice. So sort of a good news story there in terms of how we might push back on those accounts. Also, I suppose, a way perhaps of spreading some good news about the government's messaging to both communities, because it seems to have been followed. I can also say quickly that Muslim respondents were more likely to have been tested than the general population. They also happened to be more likely to have tested positive, and that links in with what we know about minority communities generally. And Jewish respondents were more likely to have been vaccinated than the general population. Next slide, please. So some of the data, like all data when you collect it, provides something of an inconvenience, an inconvenient finding. And the inconvenient finding here is that when it comes to breaking COVID rules and regulations, the Jewish group were more likely than the Muslim and the general population to have broken at least some of the COVID rules. And I can explain how we came to that finding in the question and answers. Before you move on, interesting to note perhaps that the Muslim group were no more likely to break the rules than the general population. And again, that pushes back on some of the negative media accounts we had. I also want to say briefly that we looked at religiosity within the data set, and religiosity played either no part or a very small part in rule breaking. So we might think about some of the media accounts of strictly observant communities, Orthodox Jews, strictly observant Muslims, etc. They were often depicted as being more likely, or the most likely in fact, to break the rules. Were that to be the case across the entire Muslim and Jewish populations, we might have expected to see religiosity playing a key role, and we didn't. So that says something about media accounts. And the last slide, yep, great, 2 minutes, this is good. So, right, a bit of a complicated slide, but here we go. We asked the respondents if they had low or high levels of trust in various sources of COVID information. And the graph here represents people with high levels of trust in the particular areas. So, first thing to note, the Jewish and Muslim groups had, so high levels of trust were more common in the Jewish and Muslim groups than in the general population. And that says something, I think, interesting about trust within both communities. So if you think about trust in the context of public health, but it also echoes findings that I've seen, trust in the police, trust in counter-terrorism, can you believe it? Trust in all kinds of sort of official sources or sources of authority, often higher in minority communities than you might expect. Very inconveniently for the Woolf Institute, which has published work looking at the great work done by rabbis, imams and members of the Christian clergies, both Jewish and Muslim groups, it was more common for them to have high levels of trust in the UK government than in their local religious leader. And I think for me, that disrupts any sort of essentialist views of faith communities as being perhaps gathered obediently around their religious leader and perhaps excluding more official sources of information. And I suppose what the data set shows overall is that people of faith are citizens too. Thank you.